Doctors have been saying for weeks now we're in for a nasty flu season. Now, their prediction is based on what happened in Australia already.
Yeah, what's worse, it appears this year's vaccine may only be about 10% effective. So what can you do? Here's health editor Dr. Maria Simbra.
Flu season has started.
The flu has arrived here in Pennsylvania. We've seen cases now for several weeks, and nationally there's been a significant increase in the last several weeks as well.
Some states are reporting widespread activity, others local activity.
We're seeing earlier cases, and the predominant strain is H3N2, which is different from prior seasons. For the seasons in which H3N2 predominates, those are the seasons that we see more severe illness, more hospitalizations.
And there is some concern this year's vaccine may only reduce the risk by 10%.
10% was the number in Australia. We won't know what the number is here in the United States for several months.
Australia, where the flu season comes before ours, had a high number of cases and more than the usual number of people in the hospital with the flu.
The World Health Organization decides which strains go into each year's vaccine. Sometimes the viruses mutate and change the proteins on their surface that the vaccine recognizes, or the virus vaccine mutates in the manufacturing process.
How well it works depends on the match with circulating strains and the person it goes into.
So some patients generate antibodies that are protective and others don't.
Even a little protection is better than none.
Every year about 200,000 people get hospitalized. That's where the cost really goes up. So if you can save or reduce the amount of patients who are being hospitalized, it is a cost-effective approach.
With the holidays coming up and people traveling from one part of the country to another, take extra care.
And in any given patient, it really comes down to 0 or 100. Either you're going to get the flu this year or you're not. You have to be careful even if you had the flu vaccine.
I'm Dr. Maria Simbra, KDKA-TV News.